Welcome to the Fertility Brief. I'm Dr. Angela Thayer, and on this episode, I'm going to be talking to you about ovarian reserve and AMH, decoded. You may have gotten an AMH level, or you may be thinking about it. And if you see a number, are you going to know how to interpret it, or are you going to look it up online and then try and figure it out yourself? Well, hopefully I can give you a framework here so you can really understand it. AMH is known as Anti-Müllerian Hormone, and it's a hormone that's going to tell us something about your ovarian reserve or your egg supply. You're born with all the eggs you have, and those eggs decline or die off as you age over time. But each month, you're only ovulating one egg, whether your ovarian reserve is high or low. So, what does that mean? Well, if you think about it like you're going to your pantry and you're looking inside, what's on the shelves? Is there a lot? Are they packed? You've got a lot of eggs. You have a high ovarian reserve and a high AMH. What if the shelves are only half full? Maybe it's not as good, but you can probably still put together a pretty good dinner. So think about it that way. Ovarian reserve and AMH are predicting quantity of eggs, not quality. Quality is a separate factor, and we talked about this in another video. It's the 90-day window where you're influencing the quality of that egg. How competent is that egg going to be once it's fertilized by a sperm to create a good embryo by dividing the chromosomes correctly and having the right genetic code? Think about it that way. That is the quality of the egg. The third part is fertility, and that is dependent on the egg quality, the sperm quality, the fallopian tubes, the uterus, the timing. All those other factors determine your fertility or your chance to get pregnant. Now, where does egg quantity really matter? It really matters when we think about IVF. It helps us predict how many eggs we're going to get in an IVF cycle. Think about it this way. If somebody has a high AMH and a high ovarian reserve and we stimulate with those IVF medications, we're going to get a lot of eggs to grow and pull out at the egg retrieval. If somebody has a lower AMH, the pantry isn't as stocked, and we give the fertility medications, we're not going to get as many eggs to develop because they just aren't there to begin with. So that's where the AMH is really useful for a fertility clinic to predict how many eggs we're going to get in an IVF cycle. If we get too many, we worry about a condition called ovarian hyperstimulation syndrome. And if we get too few, we worry there might not be a good embryo to work with because so many of the embryos will die off during early development. Now, the other place that it's really useful is if you're thinking about freezing eggs. Let's say you want to get 12 eggs to freeze or 20 eggs to freeze. Are you likely to get that during one stimulation, two stimulations, or three? How many do you have to do to get 12 or 20 or however many eggs you'd like to have in reserve for your future? So you can use that AMH and another test with an ultrasound called an antral follicle count. And these tests together can predict how many eggs you might get during a cycle. And also your doctor can predict how many eggs you might want to freeze for your future use. The other place where we think about an AMH level is sometimes people who have ovarian surgery or they're having chemotherapy for cancer treatment that's going to affect the ovaries. Sometimes in those cases, we'll track AMH over time to assess the remaining ovarian reserve. Now, I told you before that you only ovulate one egg each month. So your ovarian reserve and your AMH does not predict your chance of pregnancy each month. That's been shown in a number of studies over time. So if you're trying naturally, or if you're trying with donor sperm insemination, anything other than IVF, that AMH does not predict your per cycle chance of pregnancy. So you really don't even need to know what it is. You really only need an AMH level if you're thinking about doing IVF or egg freezing or one of those other special conditions. Or if you're going to a fertility doctor because it's been a while and you feel like you need to do some basic testing, that's a way to measure your ovarian reserve. It might help somebody decide whether or not they want to start treatment sooner or later based on their age and other factors along with that ovarian reserve. So again, to summarize, ovarian reserve and AMH predict quantity of eggs, not quality. Quality is separate. It's predicted by age and genetics. And fertility needs quality and other factors like sperm, tubes, and uterus. So I hope this edition of the Fertility Brief has been helpful to you, and stay tuned and subscribe for more future tips.